In retrospect, I do think that they pushed the boundaries, expecting me to kind of put up with it and not say anything. And the thing is, it was very underhanded, and it was oftentimes, hey, you got to be a team player. We all just discharge the patients back to the streets. Nobody gets psych consults around here, and I'm like, not only is that unethical, not only is that dangerous for the patient and the other humans in the world that might be harmed by their violent behavior, but it's also a risk for my medical license and my practice if that one patient decides to go out and shank somebody. So, they kind of try to label me as not a team player for pushing up against stuff like that.
Welcome to Be Empowered, the podcast. This is a podcast where we dive into the realities of healthcare and entrepreneurship. We offer our opinions, unfiltered and apologetic, and always with a dose of empowerment. We're here to amplify voices, yours and ours, challenge the status quo, and explore what it truly means to thrive. So let's get into it. I'm Dr. Santoshi Bilakota.
I'm Dr. Shala Mokbel.
And today we have Dr. Leah Houston. She's an emergency physician turned health tech entrepreneur dedicated to advancing physician autonomy and digital privacy. In 2025, she launched Evercred, an AI-powered credentialing wallet that empowers physicians to own and control their professional data. Dr. Houston, thank you so much for joining us. So do you want to start off by maybe telling us a little bit about your journey in medicine and also how being a woman kind of impacted that journey for you?
My father actually had epilepsy and it was really poorly controlled. So we spent a lot of time in the emergency departments. And I also didn't have health insurance as a child. So I got all of my care in the emergency department. So when I went into medicine, it was kind of like what I already knew. It's kind of what was familiar to me. So that's where I chose emergency medicine. I also like the idea that you have a schedule that starts and stops, that you get to take care of everyone, the old, the young, the rich, the poor, and you do the right thing for people. So I actually experienced identity theft. I worked locums and I worked at several different hospitals, went through this long credentialing process everywhere. And what people don't realize when you read these actual contracts, embedded in there in fine print is basically like, we own you now. We can do whatever we want with this data that you're giving us, and you're still fully responsible for it. Essentially, you're signing away your professional rights, your professional brand. And a hospital that I had been working for, after I left, they continued to bill under my name. And essentially what they were doing was they had doctors on a rotating schedule covering the urgent care or the fast track area of the emergency department. And when I first came on, it was my understanding that we only were covering when we were actually there, but they just were randomly rotating us through and signing us off. And so after I left the hospital, they didn't take me off that rotating schedule. And so there was, mid-levels caring for these patients, and they were signing my name as an attending. And not only is that insurance, Medicare, and Medicaid fraud, it made me unable to work because I hadn't been licensed any longer in that state. I had moved to a different state. And so the Department of Health and Human Services thought I was practicing medicine without a license. And so they revoked my privileges to bill for Medicare and Medicaid. And so it was really something that happened to me that led me to understand the depth and the breadth of the credentialing and data breach problem that we have as doctors, that led me to kind of investigate this as a possible solution.
That's frightening, first of all. I didn't even think that was like a thing that could happen. Oh my goodness. It sounds like I can't even imagine the amount of stress.
Oh,
Did
yeah.
the hospital system face any legal pushback? How do you even approach something like that?
What actually happened, I was physically working in another hospital, and the director came up to me and was like, "We have a problem." And I was like, "Oh my God, did I kill somebody? Was there a bad outcome?" And he hands me a letter from CMS that basically said, "Your privileges to bill are revoked." And I essentially had to leave my shift in the middle of the shift, and he had to take it over. And all it was a letter. There was no phone number, there was no contact. It took me 30 days to even understand why my privileges were revoked. And then it took me another month and a half, almost 2 months, to find an attorney that would take my case. And I don't know if people know about key tam, but you can do a key tam action when somebody's defrauding the government. If you blow the whistle and it's found that, what you blew the whistle on was true, you actually can collect on some of those losses. But essentially I would have had to prove that it was purposeful and that it wasn't a mistake. And so, we just ended up reaching a settlement agreement with the hospital.
There's a perception out there that these things don't happen to us, but it does. It happens all the time, right? And unfortunately, when we are especially working for bigger organizations, they have your NPI number. You don't know what they're billing, on your behalf, right? I don't know. I'm not the one who's billing, and they have their billing department. They're billing on your behalf. So this is a really interesting story, and it's really frightening that I think I would be, it would give us a lesson that always all professionals and doctors, they should pay attention to these things. They should pay attention to billing and what's going on their behalf. Were you ever kind of full-time employee for a hospital or a entity, or it was always after you graduated, you just went to locum work?
I worked in 2 W-2 jobs, and both of them were very abusive. And that's why I chose to move into locums. And I worked almost full-time and, mostly full-time, like 10 to 15 shifts a month on average I would work. So that was pretty much full-time, but I did locums. So I had more control over my schedule. And, the thing about locums is like, okay, you have a lot of autonomy in your time and your schedule and full autonomy in your practice, but you're also usually going into places that are kind of poop shows. And that's why they're so desperate for locums. So I remember I'm like, okay, order, 4 pints of blood from the blood bank. And they're like, blood bank doesn't have any blood. And I'm like, what do you mean? How am I supposed to resuscitate this bleeding patient? So, I've had situations, working in San Francisco where they would bring in people who are having severe, psychiatric emergencies, and there was no psychiatrist available, no security available. And I just had to manage it with one nurse. I made that decision because under the W-2 situation, it was much worse. They would never give you time off that you needed. When I was married, I didn't even see my now ex-husband because we were never able to, sync our schedules up despite our multiple requests and stuff. So it's not easy out there for anyone.
No, it's like being stuck in a rock and a hard place. I think as someone who's done both, just like you, my W-2 job was incredibly toxic and abusive as well. But somehow, despite all that, like traveling around, going to these small rural towns seems like a better alternative. I don't know. I feel like at least you're getting paid what you're worth in some ways. But yeah, when you go in, and neurology is a little different, obviously, but like you'll step into clinic and it's like 20 plus patients who have not seen a neurologist ever, right? Because they just don't have access to it. But somehow that's still better. So are you still practicing clinically at this point, doing locums, or are you 100% in the tech space?
I'm 180% in the tech space. Entrepreneurship is more intense than medical school and residency. But I do have a small panel of private patients that I see because there's people out there that are just desperate. You know what I mean? It's like people can't find care for things that I think are kind of basic. So it's more out of guilt. And I love emergency medicine. I actually miss it a lot, but it's just not possible to do that in this, really.
Did you feel that being a woman in medicine kind of played a role in the abuse?
In retrospect, maybe. But at the time, no. In retrospect, I do think that they pushed the boundaries, expecting me to kind of put up with it and not say anything. And the thing is, it was very underhanded, and it was oftentimes, hey, you got to be a team player, we all just discharge the patients back to the streets. Nobody gets psych consults around here, and I'm like, not only is that unethical, not only is that dangerous for the patient and the other humans in the world that might be harmed by their violent behavior, but it's also a risk for my medical license and my practice if that one patient decides to go out and shank somebody. So they kind of try to label me as not a team player for pushing up against stuff like that. Maybe they were just willing to take that risk and I wasn't. But, perhaps they were kind of weaponizing the empathy of women, which, we often have, a lot of empathy.
Do you mind telling us a little bit about your vision behind Evercred, like how that came to be? We talked about the circumstances that led to realizing there's a need for it, but not a lot of people can identify a problem and try to figure out how to fix it. So how did that work out for you?
Well, so the issue with me was that I didn't know that they were using my credentials. I didn't have any way to revoke rights to those credentials. And so in my mind, I also had gone through the credentialing process at 15 different places by that time. And I'm like, why do I have to redundantly tell them the same thing? Why do they have to primary source verify my medical degree everywhere? Why can't they do that once? And why can't I own proof of that primary source verification so we don't have to repetitively keep verifying it? I, looked around and there had been nobody that had created a tool for us to hold, store, and keep our data and to transfer it securely. And so I kind of went into Facebook and into all these doctor Facebook groups and I was like, hey guys, what do you think about this idea? And there was enough people that were like, oh my God, please solve this for us. This is horrible. We would love to not have to do this over and over and over again. We would love to not have to manage all of this administrative burden. And so I started a company and I raised money from our colleagues. And so, the company is still 99.9% physician owned. We did a crowdfund. So there was a couple of people who found us, patients, people who also want doctors to be free, who also invested. But I was able to raise $1.6 million from our colleagues to build the company.
When did you start this, and what was the progress throughout the years?
So the idea started in 2018, 2019. It was kind of like I had also been taking care of my mother, who was suffering with leukemia at the time, and thank God she's fine. She got her bone marrow transplant and stuff. So I was kind of ideating on this part-time for the first year or so. And then we raised our first crowdfund in 2020. And the initial concept, so this is always about data ownership, professional ownership, owning your professional destiny, owning your right to move, right to work, right to serve patients untethered and uninfluenced by third parties, whether those third parties are insurance, payers, Medicare, Medicaid, or it's an employer trying to tell you how to practice medicine. So that is and always will be the vision for this company. And we initially launched an application that leveraged decentralized identity, which is technology that allows you to own your data in the same way you own your cryptocurrency, and authenticate proof about data points about yourself. Now that one never really came to fruition, in part because we were under-resourced and it was more complex to build than the people that I was working with knew as they started it. But then with the new tools that are out there, with AI, with LLMs, we decided to move to a new application that essentially did the same thing. We don't currently have the decentralized identity component, but we still would like to do that, the true full data ownership in that way. But that's on our roadmap for the future now.
I guess, how do you get hospitals or physicians to start using Evercred readily?
So you can go to the website and sign up. There is a free basic wallet where you can upload and extract data for up to 10 credentials. You get free email notifications for expirations for those credentials. Now, if you want to do all of your credentials, most of us have, somewhere between 50 and 70. And this, when I talk about credentials, I'm talking about your handwritten vaccination records from when you were in medical school. I'm talking about your procedure logs, your certificates of good standing from all the hospitals that you've worked in, So we can give you a membership, a premium membership where you can upgrade and get access to all of that. The next thing we're launching is sharing. So that should be coming out very soon, a couple weeks from now. And it'll allow you to share your data. And then we're launching agents that actually pre-verify that data, that do the primary source verification for you. And we track and timestamp and create provenance data for where and when and how we got that primary source verification. So essentially, it's creating a permanent and perpetual longitudinal freedom wallet, a liberation wallet for you to move wherever you want, authenticate proof of yourself. So people find us that, we have a newsletter, we have a following over social media. And I'm also talking to small to medium-sized practices and physician cooperatives and physicians groups who need this themselves. So, this demographic is underserved in the credentialing space, and most of them still are doing this manually with paper, storing things maybe on a desktop folder, but no digital tools to automate it.
It seems to me that this is similar to something like the IMLC, like the interstate medical license, where you kind of apply for the licensing, in one state, and then that data can be used to get licenses in other states. Do you envision that? Do you envision that that you will have, like Evercred would have a database for physicians where if they want to work at X hospital, then that data is readily available to this X hospital, and the physician themselves don't need to do anything. Do you envision that?
I do. I envision that we are going to have personalized agents for each physician, where it says, oh, hey, your license is expired and you still have 4 CMEs that need to be done. Here's some options for those CMEs if you want to use these. Otherwise, let us know when they're done. And when they're done, it automates the application process for you and, those kinds of things. Now, that's not going to happen tomorrow, but that is something that I see in the future. We need to do less BS.
A big part of this BS is all the administrators that are employed for doing this BS. So AI definitely, when they say AI will replace healthcare workers, I'm like, can we start with that first? Right?
Oh yeah, they will. The administrators will definitely be replaced first. Right now what they're doing, and this is so not secure. I mean, most of us have been asked for our CAQH login and passwords. Is that not correct? And in there is our social security numbers, a lot of private personal information, including health information. And so what most of these companies are doing is they're outsourcing this to people in India or Pakistan or Philippines, who they can pay $4 to $6 an hour to manually do this stuff. Now, not only is that error prone, not only is that not secure for us, but it's also part of why it takes 4 to 6 months for us to actually get to work. So if you can create, domain-specific agentic intelligence that has the same level of security and compliance that financial systems have, that are keeping your data private, and the LLM is owned by us as a company, and so we're, if you trust us as a company, then your data can be trusted. Then it reduces the risk of fraud, errors, waste, abuse. It reduces the risk of what happened to me because you can revoke those credentials. You can see who's using them, who's not using them. I would love to also create a tool that allows us to see what's been billed under our name. How much is that employer making off of us? How much did the insurance actually pay for that procedure that I did? Because I think that we should have a right to know that.
Yeah, it's all about transparency. And unfortunately, most employers are not transparent with that data. I think for a reason, because if you know how much you're making for the employer, you can have a better negotiating power, but they don't want that, obviously.
What surprised you the most about leading a startup, basically? Were you consulting with someone who was able to help you, or?
Yeah, I mean, the whole experience was me getting a lot of help and guidance and advisement from people who knew a lot more about this than I did. But regarding the decentralized identity stuff, I learned about Bitcoin in 2012 and purchased my first Bitcoin in 2014. And I just wanted to understand the technology. We're very curious people as physicians in general. We want to learn and understand things. I also was, wanting to invest as much capital as possible. So I was learning about different investment strategies. And so when I moved to San Francisco, to Silicon Valley, I met a lot of people in that space and a lot of companies that were in healthcare were asking me to advise them. And so I kind of started just, going through decks and looking at things like that, and like being plugged into the tech community before I even had this idea, before my identity was even stolen. And so I got an understanding and a taste for what it's like. And then when I decided to actually do this on my own, I had those connections and I was able to talk to people, and I was able to kind of, I had kind of resources to go through to understand the process. Now, the biggest surprise to me, however, as physicians, we have to go through medical school, residency, our board certification in order to practice. So there's just this trust. If I contact you as a neurologist and you make a recommendation for my patient, it's very rare, unless it sounds totally off the rails, that I would question anything that you were recommending. I would just do as you said and be grateful for the consult. In tech, a lot of people have no training or extremely variable training. And technology and software development is very similar to medicine. There are domain-specific understanding of things, and similarly to medicine, where you could probably advise somebody on an urgent care issue, and I could probably advise somebody on a neurology issue. It's probably they're going to get better advice from you if it's a neuro case, etc. But people who actually build this software oftentimes like to figure it out and tinker and try to see how to fix things. And because a lot of this has never been done before, it's a very creative process, which I didn't really understand that part of it, because when you're building something new and you're solving a new problem in a new way, or an old problem in a new way, you kind of have to come up with a new way of building it. And so if you don't have somebody with a lot of experience, enough experience to know something that they don't know and when to phone a friend, then you could be in a situation where you burn a lot of money and time building something that isn't fully functional, which is what happened with our original application.
So what was the biggest challenge that you faced when you switched from being a clinician to entrepreneur?
The biggest challenge was being able to assess competency and skills of people that were working with me to build this. Nobody had a board certification in database architecture. I just had to trust that they knew how to do that. And I did vet and, get references, but that can only take you so far, especially when you don't have the domain expertise. I did end up going and getting some additional training in AI and healthcare from MIT that gave me a lot of background in software and product. And I was very, very lucky to hire a lot of really brilliant people who did teach me a lot of things, specifically some product managers and some designers that really kind of walked me through the software development lifecycle and, how that all works. And, when do you need this type of expertise? Do you need them full-time versus part-time? So it's been an awesome learning experience. I've really enjoyed it. It's been a joy to be able to do this, especially because I really think this problem needs to be solved for us. And I think it's the key to us having autonomy and freedom in the future.
Yeah, the more I hear about it, it blows my mind that something like this already does not exist, right? Because I feel like other professions have something similar. I mean, I would hope they do. I hope they're not sitting around for 60 to 90 days waiting to be credentialed, waiting to work. But the point you made about our data is just free floating around. It just is. And I don't think we really think about that. I know I haven't really thought about it either until just now. I realized, yeah, definitely someone could commit fraud under my name and I just wouldn't know.
So many people have reached out to me, especially if you're working for telemedicine. They could just order durable medical equipment under your name. The patient never gets the equipment. You don't even know it was ordered under your name, and they're collecting some kind of kickback. I mean, there's so much, it's very common. And these smaller cases, they don't do anything about them because they have these huge cases, hundreds of millions of dollars that they're actually trying to catch people doing. So, we're kind of in trouble.
What kind of feedback have you received from early users?
So the earliest users love it. They're kind of like, when is the agent stuff going to be done? When is the automatic, verification going to be done? And, that kind of thing. When is the sharing going to be ready? Because they know they need to share these credentials. So, but feedback is really good. It's very slick. It's actually really cool.
We're going to pause here for this week, but don't go too far. We'll be back for part 2 next week, and we'll tune into the rest of the conversation. Thank you.